This video will be on Pompe disease, which is classified as glycogen storage disease type 2. It is genetically inherited disease due to mutation in the GAA gene on chromosome 17. This disease is characterized by absence or decreased activity of an enzyme called alpha-1,4 acidoglucosidase. This enzyme is essential for converting the glycogen which is stored in cells into glucose, which is essential for muscle action. Pompe disease is an autosomal recessive disease, and this means that when a carrier male gets married to a carrier female, there is a 25% chance of having an affected child. The prevalence of Pompe disease varies around the world. However, the overall prevalence is 1 per 40,000 people. According to the enzyme level, Pompe disease can have two modes of presentation. First, if there is little to no enzyme activity, it's called infantile onset, which is present in the first few months of life, characterized by skeletal muscle involvement and generalized hypotonia of the baby, cardiac involvement causing hypertrophic cardiomyopathy, and respiratory and diaphragmatic muscle weakness. Second, when there is reduced enzyme activity, here the patient can have a variable age at presentation. That's why it's called late onset Pompe disease. Clinically, patient can have a variety of symptoms, but the most important is the musculoskeletal symptoms, causing limb-girdle muscle weakness, muscle aches, gait abnormalities, and scoliosis. Respiratory muscle symptoms can include dyspnea and orthopnea, respiratory insufficiency, and diaphragmatic muscle weakness. Gastrointestinal symptoms can include difficulty in chewing and swallowing, macroglossia, and gastroesophageal reflux. Here we have to note that in late onset Pompe disease, no cardiac involvement. The diagnosis of Pompe disease is crucial, and it could minimize disease progression and disability. However, what happens in reality is delay in the disease diagnosis by an average of 6 years. This is because of similarity of the disease symptoms to other diseases and lack of awareness about the disease. So any patient who have unclassified limb-girdle muscle weakness, restrictive respiratory insufficiency, or asymptomatic elevation in the serum creatinine kinase should be screened for Pompe disease. This can be done by dried blood test and GAA gene analysis. Once Pompe disease is diagnosed, testing of all family members is recommended. And here we have to know that each year after the diagnosis, the probability of wheelchair dependence is increased by 13%, and the need for assistive respiratory support is increased by 8%. Treatment is by enzyme replacement therapy, which contains the alpha-glucosidase enzyme. It's called myozyme. The dose is 20 mg per kg, and it is given once every 2 weeks by intravenous infusion.